Hello everyone, I'm Gary Toh from Taiwan Chime Medical Center. It's my honor to be here to share our experience regarding HIV stigma in our hospital. In Taiwan, we have a great improvement in HIV care. I think HIV care have improved all over the world. So we already achieved the 2030 goals of the WHO, that is 95, 95, 95 in terms of treatment and undetectable viral load, but we still have some gap regarding the detection of HIV. Even though the people living with HIV in Taiwan still experience healthcare stigma. So how can we achieve the equitable care in our hospital is a problem. There's a survey in 2018 from the Taiwan NGOs that show that 12 of them have whose medical right was infringed when they seek for medical help, including rejection, especially in dentists, and some of them might get their identity disclosure. So I think there's still a big gap regarding to reducing the stigma for HIV. So in 2018, when there's a big concept that tells us undetectable viral load equals to untransmittable, we start to know about that. Actually, there will be an increasing demand for a friendly healthcare, especially when one day there's a couple with HIV infection that come to my clinics. And she was already in her third trimester, and she was newly diagnosed with HIV. So we think we need more and more people, including obstetricians, pediatricians, to help us with these patients. So what can we do? The first thing is to know our status. As we know, my hospital, Chime Medical Center, is a HIV designated care in Tainan City, which is located in the southern Taiwan. We have 3,500 staff, 1,300 beds, and we're taking care of more than 900 HIV people living with HIV. So the first thing is we're trying to do a survey using a questionnaire to measure the stigma and discrimination in our hospital. So we collect the data from 550 of them, and then from different departments and different occupations in our hospital. And what we found is that there are still 1/3 of them that thought that HIV-infected women should not have the reproductive right. It is a very big number. And then most of them will get anxiety, especially when they're doing invasive procedure, such as drawing blood. So when providing cares for the people, so they will try to avoid physical contacts. Somehow they will wear double gloves or even wearing gloves all the times. So in the past 12 months, some people might see people unwilling to taking care of those who has HIV, or they are providing a poorer quality. Almost 35% of the respondents ever saw or heard any kind of discrimination towards the people living with HIV. So what can we do to target this problem? The first thing I think is that actually, as Dr. Bruce has already introduced, people are quite worried of getting infection. So the first thing is we're trying to set up an emergent post-exposure prophylaxis prescription system in our hospital. Once they get exposure or needle stick, they can immediately get the prophylaxis without time delay, so that they won't feel fear or anxiety. And we start staff education, design different kind of workshop or classes, and then we have a case-based discussion with different departments. So we build out a team, a care team, and with a slogan for equitable care. And this is a translation in English: reduce healthcare stigma, build up a friendly hospital. And then, yes, we start to discuss with the emergency department, and they agree to prescribe PEP for 24/7. So we got a SOP in our ER to provide not only for our staff, but also for accidental exposure from the community. So we got a press release regarding the ERPP, but what's the bad thing is that after that, if you Google my name, you'll find out the keywords such as one night stand or the condom broke, then you'll get to the information of PEP. And we're trying to design different kind of education class and talking about HIV from different perspectives from the community, including we discuss HIV regarding law, and also we invite artists to talk about HIV, so that in the hospital we only know about medicine, but actually this disease is not only about medicine, it's about life, it's about everything. And then we have a case-based discussion with the obstetricians and pediatricians about the couple I have mentioned that having HIV. But what we found is that normally, if you have an education class in the hospital, who will never come? Normally it's doctors, right? They are so busy. The nurse will come, the other paramedics will come, but where's the doctors? And then we are start to think about how do we target the gap systematically, and is there any reflex from our clients after we do these things? So what is the reflection of our clients? So that's why we start another program that targeting the knowledge, attitude, and practice. We find some of our colleagues to become our friendly ambassador, trying to promote U equals to U friendly medicine in our hospital. And then I will introduce some of the QIS+D indicators later on. In 2020, we start a program that we call Chime Friendly Medicine, and this is a calendar we have. And in every month, there's an ambassador talking about their perspective regarding HIV. So we make it to become a calendar and distributed to every clinics in our hospital. And this is from January to December to discuss about different kind of topics. And we interview them, including our superintendent, including the chief of the different kind of department of surgery, medical, emergency, critical care. We talk about HIV in every field, every perspective. And we record the interview and put it on YouTube, so that they cannot regret on what they said. No, just kidding. And this is our superintendent, Dr. Lin, when he talked about his experience taking care of people living with HIV. And finally, they chant the slogan, trying to reduce healthcare stigma. And how do we target that? Actually, normally the doctor didn't come to the education class. So we're trying to achieve them actively. So normally the doctor will be in their own department, the morning meeting of their own department. So we go to the morning meeting of every department and telling them and discuss all about HIV. This is the picture we're taking when we are in the morning meeting with the Department of Dentistry. And then I got the chance that I can present our works in the hospital leadership retreat. And finally, we got an exhibition in our hospital propagating friendly medicine at the end of 2020. So we put all the photos of our ambassador, including the superintendent, in the board, and people can take picture and they put it on the Facebook, Instagram. And yes, finally, we got a press release that we are trying to promote HIV-friendly healthcare in our hospital. And also, we got a chance to collaborate with the cardiologists and NGOs, trying to actually people, if they get the medication well, they becomes undetectable, and actually they can live happily and healthily. But then aging is another issue currently in what we're carrying for HIV clients. So that we need more and more specialties to help us to provide holistic care to them. So including cardiologists, endocrinologists, etc. what can we do to improve our quality? A continuous quality improvement is very important. So that's why we need a QI indicator. There's a chance that I meet Professor Bruce. So I know what is they did a lot in Southeast Asia as well as in America. So we're trying to translate the questionnaire that he had introduced into Mandarin in Taiwan, so that we can start to apply the questionnaire in Taiwan. So this is what we have when we translated and doing the validation last year. And what we found is comparing to the indicators back to in 2018, 2019, we found that actually there's a big decrease in stigma, as well as extra protective measures while caring for people living with HIV. For example, there's a decrease in the people that trying to use a double glove from 52% down to 30%. But this one is new, is that actually a client's indicators, this is one thing that we quite afraid of listening to this. Because normally, we think we are friendly enough. But once we have the client's indicator, we will find out there's actually, we are not there at all. For example, there's an indicator here. Did you experience discrimination from healthcare providers or other staff members? Even in last year, there are 14% of them that say yes. So that means that even though we had already do our best to achieve friendly, equitable care, but there are still gap. There are still gaps under the table. So there's still a long way to go. Even though we have an annually event for patient support group and trying to increase their self-awareness, self-identity, we also discuss a lot with the government. This is the Ministry of Health of Tainan City. We also go to the school trying to educate the students. And also, this is the stage of the gay parade in Tainan City. So from the hospital, we're trying to go out and trying to achieve the community. And then we do a lot of event or activities. So finally, one day, when the medical society and the clients, patients group, they say that, okay, they want to send a coffee car to our hospital to provide free coffee to our staff. They say they want to thank our hospital for providing friendly medicine to them. So I think that day is it's a success to us, and it means that it's not only what we did, but also the whole community know what happened in this hospital. And we finally got a chance to have an international conference on HIV in our hospital. And we won the Distinguished Medical Care Gold Award last year from the National Healthcare Quality Awards. So I think it is recognized by our government as well regarding the equitable care for people living with HIV. But then we're trying to how can we propagate this method not only in our hospital, but also to other part of the country or even other part of the world. So we got a presentation last year in ISQA, and we got our first QI S+D meeting in Taiwan at the end of last year. And finally, we also have a equitable care promotion work group in our own hospital, which is led by our superintendent. So it is not only what our own department doing these things, but also we integrate all of our partnership department in our hospital. We can do more and more promotion and quality improvement program in the future. So equitable care, I think it is not easy to achieve this target. But the first thing we do is to know our own status. Then we start the dialogue and step beyond the comfort zone. We go to different departments, talk about HIV. And what we think is that the more we know, the less we hurt, or even the less we fear. Equitable care is not easy. We should change it from the concept, and finally it will become a culture. Finally, I would like to thank my own hospital and all of our team members that goes along this together with us in these years from 2018 until now. And actually, it is not easy, because every time I will ask myself, is it worth, or what do we have really changed? But when we see the smile face on our colleagues, when we talk about love, when we see the glow on our superintendent face, when they chant the slogan, and we see our clients can walk through the shadow and live happily ever after, and we hear the cries of the baby from the HIV positive couple, but with an undetectable viral load, and the baby is healthy, no infection, then we know everything we've done is worth it. And finally, I would like to thank Professor Bruce and for his mentoring our program, and then all of the NGO we collaborated with, and finally the HAI for inviting me here. Thank you, everyone. Thank you.